everyone. It's me again. So, today I'm going to talk about critical care transport. Um, that's one of the cares of service or levels of service that I worked for a while. In case you don't know, vast majority of people don't, unless you actually work on the ambulance. There's about three different levels. What I was describing before, that's basic life support. Vast majority of um, ambulance transports are those. Um, they basically cover everything that's not advanced level or critical care. Um, and what is the advanced ALS, advanced level service, is anyone that requires cardiac monitoring. So if somebody had chest pain, they would require ALS or CCT. Um, CCT's critical care transport, it's a level above. Um, and as far as I know, the difference between ALS and CCT is the active medication administration or blood transfusions. The difference is a paramedic can run ALS calls, and a nurse, RN, registered nurse, is required for the CCT calls. Um, so anyone that's like actively needs medication during transport, um, those are the CCT calls. There's also people on respirators. Um, those are ventilators. Those are they can be ALS or CCT. Sometimes they have respiratory therapists that run the what's it? Those calls, ventilators, ALS. So, um, uh, ALS calls, they have basically a paramedic and an EMT. Usually it's the EMT that drive, actually always, because the paramedics need it in the back. But I mean, sometimes they have two paramedics on one crew. Uh, CCT is a little different. They have three, so they have two EMTs and also a nurse. Um, so I was, one of the EMTs. The partner that I did it with, um, they weren't allowed to drive the ambulance. They had like a minor accident, like maybe the week before I joined. And for that reason, I was pretty much a driver only. And it's a big ambulance. Um, so that was definitely fun. It's like the length. I don't, I think the clearance was about 10.5 feet, and the length of it was crazy. It's also extremely heavy, so making stops with that is a little difficult. Um, so this was probably like the best experience that I had working on the ambulance. Yeah, after working like BLS for some years, it gets pretty, I mean, I wouldn't say boring, but it definitely does get super repetitive, you know. You see most of the same stuff. So when I came to this ambulance company, the other company that I worked for didn't have any CCT. Um, they saw that I had years of experience, so they put me on to the CCT unit. You know, they want people that have a lot more know-how, um, experience to be working on those, and it was awesome. I actually do miss working CCT a lot. Um, I got the nurses that I worked with, they usually want like people, I mean, the people that I worked with were very close to retirement. This was like their last job um, that they were doing before. Um, and they were really cool to work with. Um, like they have a lot of experience in ICU and the emergency department, ICU intensive care unit. Um, so I would always talk to them about that. Um, One of them was a retired firefighter, and he actually worked for the federal government after that, as a flight nurse. Um, and he would tell us stories about working. for the government. He said that he got to see the nuclear launch code briefcase before, um, and he said that they would call it the football, which I always thought was funny. Um, so definitely working with those nurses, I miss a lot. But I got to see a lot of pretty intense diseases, wide variety, a lot of ventilator calls, um, and medications that are actively being transfused. Um, so I got to learn a lot. Um, got to get a lot of good experience seeing all that. Um, One of the nice things was with those ventilator calls, it made me learn a lot about how ventilators work, um, like vent settings, which is super important when I started working in the emergency department, um, and like basic troubleshooting that comes with uh, working with ventilators. Of course, we have respiratory therapists that work in the emergency department in hospitals, and they're in charge of setting up the ventilators and all that good stuff. But I mean, like basic troubleshooting, it's pretty important because those alarms go off all the time and they're super loud. And a lot of times it's just like a really easy fix um, to, get the alarm to stop going off. So getting experience with that was super important. I got to learn a lot. And I say to a lot of the other EMTs that I meet, I encourage them to try to find an ambulance company that offers CCT. And I say after, you do BLS for, I don't know, a year, something like that, that you try to move on and try to work on a CCT unit because you get to learn so much. Get to see a lot of different pathologies, get to learn a lot of different medications, um, different lab results that are important. Um, so all of that was probably like some of the best experience that I got on the ambulance. I do also want to give a shout out to my former partner on the ambulance, the other EMT that I worked with. Um, she's in PA school now, and we would spend 40-hour weeks together for months on end. Um, So it's really important that you have a partner that you can get along with. Um, and she's in PA school now. We still hit each other up every now and then, but I do want to give her a shout out. Um, so some of the like more intense pathologies that we saw, we got a decent amount of hospice calls, which is like taking somebody back from the hospital back home. So, it's end of life care. They have terminal illnesses. It's always, you know, it is sad to see the patients go through that, but it's way more sad to see like the families, and how it's affecting them. That's the real sad stuff. Um, probably, probably the toughest I remember specifically was somebody had bone cancer, and um, whenever somebody has bone cancer, they just have terrible pain throughout their entire body. So you make sure you're super gentle with them. And since I was a driver, I would go, slow and steady as much as I can. But driving in Los Angeles, these roads are some of them are pretty tough. A lot of bumps. So whenever I hit a bump, you hear them writhe in pain. So sad, honestly. Um, it really makes you appreciative of the health that you have doing those hospice calls. We also got to do a decent amount of stroke calls, heart attack calls. And with those ones, time is super important. So I got to drive with the lights and sirens, which you don't do pretty much ever on BLS ambulance crews. And I mean, you, yeah, of course you become EMT to help people, but a lot of people, me included, when you become an EMT, you think, oh, I'm gonna drive the ambulance all the time. We're always gonna have the lights and sirens go off. Wee woo, wee woo. The ambulance goes wee woo. And I finally got to get a lot of experience driving like that. Code 3 is what it's called. And yeah, I mean, it's stressful, um, you know, driving like that, but it's a massive power trip too. Um, I do miss it sometimes. Um, so there's like a lot of rules and regulations as far as driving code 3 goes. You can't just gun it. You have to stop at the intersections. You have to, um, you can't do it on the freeway. Um, the police, I guess, are allowed to do that, but ambulances aren't. But watching everyone pull over for you is a massive power trip. Um, so one of the more selfish reasons that I enjoy doing CCT. Uh, but yeah, also, those nurses were super helpful answering all the questions that I had regarding like the different pathologies, especially lab results. I got like pretty good handle of lab results because in the transport paperwork they have everything that they did at the hospital, going from like one to the other. So I'd go through it with them, the nurses, and they would explain to me, "Oh, this lab result's terrible. Um, this lab results okay, the ranges, the specific labs that you're looking for." It all made me a better healthcare worker. Um, and again, that's why I really do encourage EMTs to try to get CCT experience because I mean, there's only one way, the best way to learn, um, isn't really from a textbook. I suppose some people can do that well, but um, there's no better experience than actually just doing it. So, um, yeah, I mean, that pretty much uh, outlines my experiences there. So yeah, also medications. The I got to learn a lot about medications, and it's impossible to learn all the medications, but I'm still learning a lot as I go along. But at least gave me a decent, good grasp on it. So, just gonna end the commentary there. Pretty much out of footage anyway. But yeah, that's all. Uh, I guess the next one I'll talk about my experiences talking about the hospital, which I'm currently working at. But yeah, um, all that experience, it's good experience, but especially CCT. If I ever do go back to the ambulance, I definitely would have a preference to go back to CCT unit because that was awesome. Um, I got to learn a lot. So that's all for me today. Um, I'll see you guys tomorrow.